Hi, my name is David Araton. I'm on the faculty at the NYU School of Medicine and the New York VA Medical Center. And I have had an interest in PNH going back to 1994. And I have been connected with the AAMDSIF since almost that long. I am very much indebted to the organization at times for having funded my research and also for having provided support for so many of my patients who have diagnoses of PNH, aplastic anemia, and MDS. And now I'd like to give my colleagues who are also on this panel a chance to introduce themselves.
Hi, I'm Eileen Weitz. I'm a professor of medicine at the University of Southern California, and I've been involved with PNH for many, many years. I have over 40 PNH patients that I follow, and many of them have connected on the AAMDS platform.
Hello, my name is Satish Jonat. I'm an assistant professor in pediatrics at Children's Healthcare of Atlanta and Emory University. I have been taking care of adolescents, children, as well as young adults with PNS for just over 10 years, and I have been involved with the AAMDS Foundation for the last few years.
PNH is a blood disease that touches on three areas in hematology. The first is breakdown of red blood cells. That's what we mean when we say hemolytic anemia. The second is bone marrow failure that is similar to, or in some cases identical to, aplastic anemia. And the third is a tendency to form blood clots. So the treatment of these can be divided into those three categories. For bone marrow failure, when it occurs in PNH, that's very similar to the treatments that are used for aplastic anemia. For blood clots, either to prevent or to treat blood clots that have occurred, that's a whole field of medicine that involves anticoagulants or blood thinners, and there are more options for that now than ever before. And for the breakdown of red blood cells, we now have 3 new treatments to prevent that. And for at least 2 of these treatments, we know that this will also help prevent blood clots. But a few words about the old treatment of PNH before we had any of these specific treatments was, first of all, to give transfusions when the patient needed transfusions, to make sure that they had adequate levels of folic acid and iron and vitamin B12. And some patients with PNH can get overloaded with iron, so one has to be careful with iron repletion in patients with PNH. And nowadays, we are much more focused on the targeted therapies, such as the first one that was approved was eculizumab or Soliris, and then a very similar drug that has a longer half-life and is easier to give, ravulizumab or Ultomiris, and then more recently, a drug that works a little bit differently on a different complement protein called pegcetacoplan or Empaveli. And that drug is different in that it has to be given by self-administration. And for some patients, that's better. And for some patients who prefer to come in to get the infusions of the first 2 drugs that I mentioned. In the old days, before we had these drugs, we were worried about maintaining the hemoglobin and preventing thrombosis and treating thrombosis quickly. Nowadays, we are much more focused with our patients on dealing with the side effects of these drugs, particularly the risk of infection. So most of the time with my patients with PNH is spent on making sure they are vaccinated, making sure they know what to do if they have a fever, namely come into the emergency room without delay, meaning immediately. And also making sure that they have letters that they can present to the emergency room staff, who often don't understand why an otherwise healthy looking person is coming into the emergency room with a fever. I give my patients a prescription for ciprofloxacin that they carry with them at all times in case they can't come into the emergency room. And something that's been done in Europe for a long time that we're starting to do in the United States is putting everybody on penicillin, at least those who are not allergic to it, in order to prevent at least some of the cases of infections. So now I'm going to turn it over to Dr. Weitz, who's going to talk about her perspective on some of the new treatments for PNH, and then to Dr. Chonat, who will be talking about particularly a pediatric perspective on PNH.
So thank you, David. A lot has changed in the treatment of PNH since I was a resident and fellow when I first had my first PNH patient. And since 2007, we've had approved complement inhibitors. And these complement inhibitors target different parts of the complement system. And since we know that lack of regulation of the complement system is driving the complications of PNH, this has been very important and a very important change in the therapy. As you've heard earlier, there are 3 approved complement inhibitors for the treatment of PNH: eculizumab, which is a C5 inhibitor; ravulizumab, which is a longer acting version of a C5 inhibitor, basically derived from eculizumab; and then pegcetacoplan, which was approved about 1.5 years ago, which blocks the conversion of C3 to C3b and the generation of C3 convertase. And these drugs are very effective. In my experience, not all of the patients who get a C5 inhibitor will normalize their hemoglobin. And we know from Antonio Risitano's data that only about 20% of patients will have a relatively normal hemoglobin with a C5 inhibitor. We know that Ravu seems to be more effective at blocking C5. And patients who were breaking through because of the short half-life of eculizumab seem to do better when they're on ravulizumab, the long-acting drug. However, there are many patients who on ravulizumab are still anemic, and that was the impetus for developing a drug that blocked up higher than C5, and that's pegcetacoplan. And we know that there is a significant increase in hemoglobin in those patients. We also know that complement inhibition appears to be very effective in suppressing the thrombogenicity of the disease by suppressing D-dimers and hemostatic activation. And that is certainly true for C5 inhibitors, and there is some data to suggest that that may be true for the C3 inhibitors. All of these drugs are now available. There are several new drugs that are being adjudicated as we speak, including an inhibitor of factor B, an inhibitor of the alternative pathway of complement, as well as factor D, which is the cofactor for factor B. And the phase 3 trial of iptacopan is being adjudicated at this time. The trial is complete. So the important thing about that drug is that, number one, it's an oral medicine. So hopefully we will have an oral option in addition to the sub-Q option and the IV option. For ravulizumab, a sub-Q form has been approved by the FDA and is now available. But many patients really like the every 8-week dosing of ravulizumab.
Thank you, Dr. Sarton and Dr. Weitz. I'm a pediatric hematologist, so certainly taking care of several patients who are young children to young adults. I think it's important to recognize that while PNH is a rare disease, it is even rarer in children, who account for approximately 10% of the patients with PNH overall. And we've seen from several studies of the symptoms of PNH in children, as Dr. Artin mentioned, the children tend to have slightly less hemolysis and may also have a slightly lower risk of blood clots, and also could be because they have gone through life at a shorter period, and also they may have a less other comorbidity such as diabetes or high blood pressure, etc. What we also seen that, as discussed earlier, with regards to the association of PNH with aplastic anemia, in children, we slightly more common to see aplastic anemia PNH combination than the classical PNH, where there is marked hemolysis, or where there is marked breakdown of red blood cells, and they have a close to normal bone marrow cellularity, or in terms of the number of cells in the bone marrow, as mark that we use to decide if the patient has aplastic anemia or not. In addition to the diagnosis, it is very similar to the adult counterpart, and also the supportive care. When it comes to medications, I think in addition to the supportive care that Dr. Artin mentioned with regards to management of anemia, taking care of iron deficiency, other vitamins, managing blood clots, complement inhibition has certainly been used only the last few years. As you may know that in adults, the eculizumab Soliris was FDA approved in 2007. And after that, for several of our patients who were under 18 years of age, since blocks complement C5 and can be given intravenously every 2 weeks, many children are currently on Soliris. And since the Ultomiris or ravulizumab, which was approved in 2018 for adults, was only approved in 2021 for children with PNH, and it is one which blocks C5. It's important, depending upon the body weight of the patient, it is given intravenously every 4 weeks or up to 8 weeks, depending upon if they're closer to the adult age and body weight. So currently, we only have ravulizumab, which is the only FDA-approved medication for children and adolescents with PNH. And this was after a study which was conducted across 6 countries to ensure that we have enough patients. So we enrolled 13 patients across 9 sites. And after 26 weeks, we were able to show the efficacy and that this medication was comparable to the data that's seen in adult patients. As mentioned earlier, these studies, including the one which is conducted here, led to the FDA approval in June of last year. With regards to new anti-complement therapies in children, as mentioned earlier, the pegcetacoplan, which targets complement C3, which is a protein which is upstream to the C5. So it has currently ongoing clinical trials, and here at Children's Healthcare of Atlanta is one of the sites in the United States. As you may know, that it was FDA approved for adults with PNH last year. We hope that these clinical trials in the next few years will help bring in this additional drug, which is shown to be beneficial in some adult patients with PNH as it improves the hemoglobin. Additionally, there are other clinical trials ongoing to target C5, and we are not there yet in terms of targeting such as factor D, the oral medication that's ongoing in adults. With regards to precautions that to be taken while on complement blockade, in addition to what Dr. Artin said, we also discussed the risk of meningococcal infections, ensure the immunizations are given at appropriate time, and also ensuring that we discuss that this is a lifelong treatment, it's a chronic illness, and also ensure that the quality of life and the risk of organ damage is closely monitored. Thank you.
Thank you. So today I would like to describe a little bit about the Global PNH Patient Registry. This is being sponsored by the AAMDS International Foundation in conjunction with the National Organization of Rare Diseases, or NORD. And next slide. So the purpose of this is to collect data for patients around the world to share information about PNH that will fill current and future gaps in research. And this enables us to share our data across different institutions and will hopefully empower and unite the PNH community through shared knowledge, and also collect data on demographics and quality of life, and hopefully increase knowledge and understanding the progression of the disease. Next slide, please. So this is a natural history study that consists of electronic surveys, and it will hopefully capture information about patient experience and disease progression. And it is the patients or their caregivers or guardians that can enter information from anywhere in the world, and this makes it easy to contribute. The data is made anonymous and is stored securely within the registry. Patients will have access to the collected data. The participation will be ongoing with periodic updates and new surveys added. And the foundation may share the de-identified data with individuals or institutions that are conducting clinical research or clinical trials. So now I'd like to turn it back to Eileen, who will talk about why this is important. Before I do that, I should say that if you go to the pnh.imrare.org website, you will get the first slide that we showed. Maybe you can go back and show that slide. This is the screen that you will come to. Thank you. Eileen?
So you might ask, why should I participate in the PNH registry? Well, many of you may have participated in a registry following the clinical trial that you participated in, but not every patient with PNH is part of a clinical trial. And so we need long-term longitudinal data to see how patients are doing. And the PNH registry, sponsored by AAMDS, is devoid of any commercial bias. It is strictly to collect data on a variety of different topics. And again, you don't have to be part of a clinical trial. Whether or not you were or are is helpful information to know, but it's not required for participation in this registry. Also, we need to be able to use this information, as many of the extension studies have stopped, and there's no further way to collect data. So you can really make a difference in helping us to obtain more information about your disease, and that may affect how we approach the disease later on. Dr. Shanath?
Yeah, thank you. This is registry is especially important for patients who have a rare disease, and also in children where the disease is rarer, as I discussed earlier. It's important to recognize that this is a natural history study. So the idea is to comprehensively collect as much information as possible and go forward with it. And the information is collected directly from the patients or carers. So hence it actually gives understanding of several other variables that we may not be able to collect during a routine clinic appointment. It's also important to note that some of these diseases progress over time, and hence some of the clinical trials are short-lived or for short duration. You may be able to learn what may be happening on these patients many months or years even after the diagnosis. It's also important to recognize that this is an international registry, so hence we will be able to collect information on several number of pediatric patients with PNH, so not just from one country. So hence it helps to increase the number, but also brings in the value of children or young adults from different parts of the world, different ethnicity and racial groups. And as mentioned earlier, any legally authorized representative, so it could be a parent or grandparent, a caregiver, or a guardian, can actually, whoever has a legal authority can grant consent and fill in the data. So it doesn't have to be the patient or the study participant, especially if they're very young. And that's especially important to be able to collect enough data as we go forward. And for all these reasons, we all strongly recommend to be able to be part of this registry, as it's only going to help not only the investigators but more importantly, the patients and their family members. Thank you.
So I was asked to comment on my best advice for patients with PNH in 2022. My first piece of advice is to have a good working relationship with a hematologist in your community, number one. Number two, to have a relationship with a PNH expert who has seen a large number of cases of PNH, because a lot of community hematologists have seen just one or two. And there are a number of us in the country, and you can get information through the AAMDS International Foundation. Further information about PNH can be obtained by looking up clinical trials of new drugs, which may be appropriate for some patients. And though there's a website that will tell you about clinical trials. And also to please participate in the PNH patient registry so that we can all learn more about the condition. The prognosis for PNH patients has been getting better and better. I should point out that the life expectancy of patients with PNH is almost identical to age-matched controls. And this is an important point because, number one, it's a reason for optimism, but we only achieve that life expectancy if we make ourselves available of modern medical therapies for thrombosis, bone marrow failure, and breakdown of red blood cells. And there's a very important point to be made also, is that I have patients with PNH who are now doing very well from the standpoint of their PNH, and are now in a situation where they need to think about the rest of their health. So just because we've got PNH taken care of with some new drugs, doesn't mean that you can't neglect your blood pressure, your sugar, your weight, anything else that fits in, smoking, anything else that fits into general health. And that's all part of it. I wish you all the best, and I'm going to turn it over now to Eileen.
So I'd like to echo what David said. I think you really need to have a good working relationship with your local doctor, but many of them, you are the only PNH patient that they have. So you really need to be evaluated by an expert, a local expert in your area. And you can do that either by obtaining an appointment to see that person, or by contacting them by email, and having them work with your doctor so that both you and your doctor are educated as to what's available and what to look for. Don't be afraid to ask your doctor or ask your expert about up and coming trials and new drugs, and to see whether or not who's got a trial available for you. You can find lots of clinical trials online, so it's an easy way to find out things, or contact AAMDS, and they will help you navigate the myriad of clinical trials that are available at the present time. Most importantly, stay up to date on your vaccinations. And that's not just meningococcal vaccine, or for the little ones, pneumococcal and Hib vaccines, but stay up to date on your COVID vaccinations, because COVID is a very complement amplifying condition, and you don't want to get COVID if you can help it. So I think that those are really important. Just remember to learn as much as you can. And if you don't understand it, just ask your doctor. And if your doctor can't explain it, then contact someone else who can explain it to you.
Thank you. From a pediatric perspective, I would like to only echo what Dr. Arter and Dr. White's actually discussed. It's important that to look out for clinical trials if available. Ask your hematologist, your treating hematologist, are there any clinical trials available? As mentioned earlier, it's these clinical trials which what helps to approve the medication, and we know the medication can be safely and effectively be given to a child. So hence the importance of clinical trials. Participating in it is very essential. Many times, many hematologists might not have even seen a single patient with PNH, let alone be 1 or 2 patients. So it's important to reach out and look out for specialists in your area or even far away to be able to at least get a virtual appointment to discuss the treatment options. Pediatric PNH especially is in a changing treatment landscape. There are several studies going on to not only looking at the safety efficacy of new drugs, how better to deliver these drugs, especially to a child. So improving delivery is a key. It also key is the supportive care and the disease monitoring to showing up for clinic appointments. I know it's a burdensome can be, especially for patients and also family members. But it's important to ensure that the immunizations and antibiotic prophylaxis, if your hematologist is putting you on, are very closely monitored. It's also important that when you go to the emergency department with a fever, is to inform them to take your card, a treatment card, to show that what you have and what is the immediate treatment that needs to be offered to you in the case of fevers. And I cannot stress any of the other facts that my other colleagues actually discussed earlier. And feel free to reach out to AMDS, who has contact details of several of these physicians throughout the country. Thank you.